Try these numbers on for size. $340 billion. That's what the president's health care law will add to the deficit, according to a new study. Charles Blahhouse, who has been on this very program, did the study. He serves as the GOP public trustee overseeing Medicare and Social Security finances. The White House responding to the study saying, quote, opponents of reform are using new math while they attempt to refight the political battles of the past. Twila Brase is the Citizens Council for Health Freedom president. Twila, thank you so much for being here. Do you agree with this math, looking at what Charles Blahhouse has done?
Yes, I do agree with it, and I think that it's interesting because nobody actually knows what the real numbers are going to be. So it's sort of a political game for one side to say it's going to be this much, and one side say it's going to be the other. But I do believe that the cross projections were very low at that the federal law was passed, and that was a part of the political game to try and get it passed. And I do believe that it will be much higher than anybody expects. And his numbers just go to that point, and they could be even higher than that.
Well, Medicare is the prime example. When Medicare was first implemented some 30 years later, it was 10 times what was initially projected. And because you have to factor in what Congress will and won't do, again, with the doctors' fix, trying to cut reimbursements from Medicare to doctors, which they keep basically kicking the can down the road year after year. We saw it this year.
Right. Medicare, Medicare is really a debacle for everyone to deal with, but the fact of the matter is they're not going to not pay doctors, and yet the whole premise of the federal law was that the doc fix was never going to happen. They were going to cut the doctors by 30% and even higher than that into the future, but it didn't happen. It's not going to happen. It's one of the things that it wasn't part of the Obama administration's projections. And all the suspected savings are likely not to happen, and many of the costs that they were talking about are actually going to be higher. And if you look at Medicare and Medicaid, what you'll see in the law is that they cut the cost, or the amount of dollars going to Medicare by $500 billion, but they used it to fund an expansion in Medicaid. And so there was no cut whatsoever. And the Medicaid program is expanded to grow exponentially. And top it onto that is that they are now going to tell all the policies what they have to cover, which is called essential health benefits. Nobody really knows how expensive that could become, because the secretary herself gets to decide what has to be covered and what doesn't.